Hi, and welcome back to LW Pharmacy Technician School channel. My name is Lindsay, and I'll be with you today to get you through this content. Make sure you grab your paper, pen, and a notebook so we can jump in and get started. We're going to be looking at medications, top 200 drugs, part 3. Let's jump into it. The first topic is drug-to-drug interactions. So if you are studying for your board exam, there should be some sort of outline that tells you the content that you should be studying. You don't want to study content just, all willy-nilly. You want to be intentional about what you're studying and what you're doing. So drug-to-drug interactions is definitely a part of pharmacology. And not only are we studying the top 200 drugs, we're also studying keywords. So keywords can help us to get to the correct answer, okay? So drug-to-drug interactions, that means that's when one drug or drug A interacts negatively with drug B. Typically, when we think about drug-to-drug interactions, we're always thinking about the negative effect, right? Because our job in pharmacy is to ensure that there's no medication errors that take place, okay? So it says, which of the following drug classification will reduce the effectiveness of oral contraceptives? Oral contraceptives is birth control. It is birth control that is taken by mouth. The word oral stands for by mouth. Contraceptive is birth control, okay? Reducing means that it minimizes the effect of it, right? So when we think about drug classes and what reduces the effect of oral contraceptives, we want to think about drugs that go against it. And so typically when a person is being prescribed one of the drugs listed below for the multiple choice, they're also told to take it with to use extra precaution, right? So that means that if a person is on birth control and they're prescribed one of those multiple choice, they're normally told, make sure you use extra precaution because this may not be as effective as it would if you were not taking that medication. Make sense? Okay. So when we're thinking about this, we're always talking about antibiotics. Antibiotics will reduce the effectiveness of oral contraceptives every time, okay? Write that down. Antibiotics, okay? It could be any antibiotic. If someone is on birth control, we want to make sure that they are taking or using something else to prevent pregnancy. The next one is generic drugs. This is number 2, okay? We're going to be moving along in this video today because I want you to get this information, write it down. Remember, you can always pause this video if you feel like, oh my God, Lindsay, you're moving fast today. You can always pause this video in order to go back and see what I said and try to write everything down. Also, if this channel is helping you, make sure you subscribe and ring the bell for notifications. Also, like and comment and share this video. It just helps the algorithm and it helps to keep the content flowing and going so other people can see it too, okay? Which of the following is the generic name for Plavix? Plavix, generic name for Plavix. It's going to be A. So if you said letter A, you got it correct. Letter A is correct. Remember, warfarin, letter D, is an NTI drug. So write that down. Letter D is an NTI drug, okay? So you definitely want to make sure that's something that you do remember because NTI, narrow therapeutic index drugs, are very much on your board exam and they're on your blueprint, okay? Shout out to all my friends who are tuning into this video, who are studying pharmacology, and you're not necessarily becoming a pharm tech, but you're studying pharmacology for other reasons and you're pursuing other careers in pharmacy or in the healthcare industry. Shout out to you and thank you for watching. The third one is indication of medication. Indication of medication, right? Which of the following condition is indicated? Which of the following condition is, look, y'all know I told y'all, if I don't know, I ain't gonna go crazy. The S drug indicated for, right? And I did highlight the S drug, and then I also highlighted an infix inside of the drug name to give you a hint, right? So remember I told you that prefixes, infixes, and suffixes are used to help you remember the drug name. So the prefix is always going to be the first few letters of the drug name. The infix, which is what I have highlighted, is the middle letters of the drug name. And then the suffix is going to be the ending of the drug name, okay? So you're going to see GLI is highlighted and underlined in this particular drug. And GLI, can be a hint for you when you're thinking about diabetes, right? When you're thinking about diabetes, you're thinking about sugar, you're thinking about glucose, you're thinking about things of that nature. You want to think about GLI because most of those drugs that are used for diabetes are going to have the GLI in it. GLI, GLI, GLY, GLI is something you will definitely see when you're thinking about diabetes and drugs that are used to treat diabetes, okay? Let's clap it up for Zuma. Zuma is a friend of ours who has completed and passed her board exam. She has been certified now, and she has moved on with her life. We're so excited for her. Her story is one for the books, and she used LW just to become certified, you know. So if you're out there wondering, will this really work for you? Will this really help you? Yes, it will. Yes, it will. Stay with it, stick to it, be consistent, be intentional, and you can be a success story that we highlight in our videos, okay? If you passed your board exam, please make sure that you drop a comment, send me a picture because I would love to highlight you in our videos and share your success with the world. Indications of medication. So when it says which medications is the drug of choice for cardiac arrhythmia? Cardiac arrhythmia, okay? So we're talking about the heartbeat, right? When we think about cardiac, we automatically think about the heart, right? Cardiac disease, cardiac. We're not thinking about cardi, we're thinking about cardiac, okay? So we're thinking heart. It says indication of medication. And so when we're thinking about the medications, we're now thinking about what is used for the heart, okay? And digoxin, write this down, is a medication that is used to treat cardiac arrhythmia. The rest of the multiple choice answers are used to treat high blood pressure. Furosemide, lisinopril, and the last one is used to treat high blood pressure, okay? So on this particular slide, you are getting 2 birds for 1 stone, right? You're learning what digoxin does. It treats cardiac arrhythmia. And then you're also learning that the other multiple choice are used to treat high blood pressure. Please write those down because that is something that you will see again on your test or in their pharmacy world or even in healthcare, okay? So if you're going into that, you're studying for nursing, you want to see these things and write these things down. Drug dietary supplement and drug nutrition. So when we think about drug dietary supplements, that can be like an iron pill, that can be vitamin C, that can be vitamin D, that could be any of those over-the-counter vitamins that you're utilizing because those are the things, you know, that people are taking to put back in their bodies what they're not getting out of their food, right? And then you have drug to nutrition. So drug to nutrition means that this drug is interacting with the food that the person is eating. So drug to dietary supplement means that the drug is interacting with the vitamin C, the vitamin D, vitamin K, whatever, so on and so forth. And then drug to nutrition is that the drug is interacting with the food that they're eating. Because that is a thing where the drug can interact not just with the supplements, but it can also interact with the food that you're intaking, okay? So this particular question is going to kill 2 birds with 1 stone too. Baby, look, we're not working harder, we're working smarter, okay? We're making sure that we're getting things completed while we have the time instead of having to go back and redo things. So this slide is jam-packed with extra information so you can kill 2 birds with 1 stone. Dairy products or antacids will reduce the effectiveness of what? Dairy products or antacids will reduce the effectiveness of tetracycline. Tetracycline, letter D. Tetracycline, well, I can't get it out. Tetracycline is one of the drugs that will be reduced by drug dietary and drug nutrition, okay? So you want to make sure that when a patient is taking this particular medication, that that they are aware. It's not our job as technicians to tell them, but the pharmacist or the nurse will let them know, hey, when you're taking this tetracycline, please make sure that you are staying away from the dairy products and the antacids because it will reduce the effectiveness of tetracycline, okay? I also wanted you to know that all of the multiple choices that are listed here are all antibiotics. Every single one of them are antibiotics. Write this down. Even though they're antibiotics, they are used to treat different bacteria and different infections throughout the body, but they can all be classified under drug classification as an antibiotic. That is important to you, okay? Generic name. Which of the following is the generic name for Diovan? Diovan. Generic name for Diovan. Valsartan. Letter D. Valsartan. Generic name for the generic name for Diovan is Valsartan. Okay. You will also notice that all of them end in the suffix ending sartan. Sartan, S-A-R-T-A-N, sartan is the suffix for all of these drug names, which means that these drugs are all used to treat high blood pressure. High blood pressure. So any of these could be used to treat high blood pressure, but only one of these are the generic name for Diovan, and that is letter D. Okay? Make sure you're writing that down. Indications of medications in drug class. So which of the following medication is a protease inhibitor used in the treatment of HIV? HIV, remember we talked last week that anything that is viral is most of the time, the drug will end in VIR. Anything that is used to treat a virus, most of the time, the drug ending will be VIR, which is the abbreviation for viral. Right? And we know that HIV is a virus that affects the body and it is very contagious, right? And so for this particular answer, the letter is C for this particular question. And I want you to notice that the drug ends in VIR. VIR is what that drug ends in. Okay, make sure you're taking notes and writing that down because that is a tip for you. And that is the suffix for that particular question. So anytime you see something with VIR and you're being asked about a virus, most of the time you can lean towards that particular answer because that will help identify the virus in which one is being treated, okay? Indications of medication. Which of the following medication is indicated in the treatment of angina? Remember, another word for indicated is use. Another word for indicated is use. I know that sometimes you see these questions and they use a different type of vocabulary that we don't use every day, and it can be kind of tricky, but another word for indication is use. So you could also say, which of the following medication is used in the treatment of angina? Angina is going to, again, be speaking about the heart, the chest, right? So we're thinking about angina, and it is going to be nitroglycerin. Nitroglycerin. I think I have an extra E at the end, and I do on letter C, so you can just drop that extra E, but it is nitroglycerin. And one thing you want to remember about nitroglycerin, write this down, that it is always dispensed in the bottle that it comes in. Nitroglycerin does not have any control or safety tops on it because if a person is having some sort of angina attack or something is happening, we need them to get that medication quickly, very quickly, okay? We keep it in that dark bottle because we do not want any sunlight to disrupt the stability of the drug. And so everything is kept in the glass bottle and it is not dispensed with a childproof cap because we want them to get to that drug very quickly and very easily, okay? If they're taking the tablet, which is more so common, they're going to put it underneath their tongue. It is a sublingual tablet because if a person is having chest pain, trying to get them to swallow a tablet is probably impossible. So we have them put it underneath their tongue, sublingual, and allow it to do what it does, okay? Write that down. Nitroglycerin always dispensed in a glass bottle, the original container, and it is never dispensed with a childproof cap, okay? Never dispense with a childproof cap. Make sure you subscribe to the channel if this is helping you. Brand name. Which of the following is the brand name for albuterol? Which of the following is the brand name for albuterol? And your answer is going to be letter A. Letter A is your answer, okay? All of these that are listed are inhalers. Write that down. All of these are inhalers, and they all can be used for oral inhalation, okay? So when you see Pulmicort, Symbicort, you see all of these different inhalers, you know that they're all inhalers, okay? Typically, inhalers are used to treat upper respiratory conditions, and so that's what this would be for. Albuterol specifically is used to treat asthma, okay? Indication of medication. Which of the following medication is indicated in the treatment of bipolar disease? Bipolar disease. Remember, bipolar disease is a disease that affects the nervous system, okay? And when we think about the indication of medication for bipolar disease, it is lithium. Lithium is an indication of medication used for bipolar disease. Write that down. Okay. Back to Zuma, she did it. We are so proud of her. Today's video was a quick video. I wanted to make sure that I get the information out to you all. If you have anything that you would like for me to cover that you have not seen, please let me know. I will put it in the queue after we complete our, we're on kind of like, I don't want to say a quest, but we're kind of like doing a series on medications. And so I want to get through the top 200 drugs, medications before I bring anything else out, just because that's one of the biggest acts that I've had from my Facebook study group. If you're not a part of our Facebook study group, please make sure you click the link in the video description below so you can join the team and join the party and see what other people are talking about. People all throughout the country who are studying for their board exams just like you. I'm so glad that you tuned in today. It is a beautiful Sunday. I hope that you enjoyed the content, and I look forward to seeing you next week, okay? Next week, same time. Bye. Take care.